Navajo Nation and all our friends and relatives off the Navajo Nation, thank you for tuning in to our weekly town hall updates for COVID 19. And today is May 4th. May the 4th be with each and every one of you today. We are also requesting those out there that have yet to get their shots or even their boosters to do so today. There's a lot of efforts going on throughout the Navajo Nation to get people their shots. So let's get our armor on and continue to fight against COVID 19. So let us pray. Shdiyan God yod a dijikwa inanaha in lagi ba nitsen. Aro di kwa ishin hilya ishdi chosto itini to kusanskagina states at the Williego. Enaha nachekodi licht and nebiki apakao ashladin hahot zogo. Aro eben nachekon tsodil zinshdi in yod a. Aro nachandal neshigi. It's allowed his el indan linigi. Ni Washington jin dal neshigi altsko. Kon hik een hid nan halchin. Ni hik istan linigi. Kodon hika natjahagi. Di kosto doitini. Di bikije da bahagi. Bikidin e do les bahul ya do les kon halchin. Ni hik edan leni. Ni hik istan leni. Lan hika je. Eishin do bis hon do les. Kon hik een hid na. Nfandal neshigi do bikin do les balchen bikedan lenigi is ina des enigi edo bikiden do les ani skopon bi tradi kre di de kosten skagina hast aids ata akonde di yakoni nasnigi naha da hui nish di okay naha in la With la kon hik eni hinna so that the zinigi benachin she yakon naha in la aro kon azel in dan zinigi hi koje hi Washington ji yandal neshigi hanet hi je kunda yil egi ba hehni tsinjo benach na antin do na hata benach kon kne di beach ini ka na halet nte da sinil tsao tani azel in hit sala ha ultra dan linigi da junle di da ishtraje hojish edo aje pada ultra agido batso deilzen aron da ishtragido kehela ani spolta nature do kishin deil nashori kota skai je mo benat kadadi nasnegi bi chini ka na fonde late lo de keda hat enegi do je da bedil chilash ngode ahot ya kadan zendo le late na da ilagi ahot da dilni da huilyago ni masan hi chain nada nasta azlegi bada huilyago na khalchin bada huilyago ben nacheko di bi chidi kha judan hi nashem o de keda hat ingi bilagana da na khaida na khaisha jinida na da oz da altso khalait da ilala winsinshi akondan he kodo digin bada hui ni hodi ne digin kha ilago ben nacheko na bi chidi kha Eishin got ya kon bada huil net doles. Lego alait da illa dan hisnigo digin kha illa da bidi ni doles. Jogot in kha koto an hik eni hinna bat so dil zanota. So kon so shin ya so da dil zanigi benach shidin yot nakhadi listo nasron neje di hit zilo nane katoles. Nije benach Jesus Christ. Amen. Thank you, everyone, for joining us on the town hall meeting. And I'll just quickly get into the updates. I'm here in Twin Arrows, Navajo Nation. A couple of meetings happening here. Of course, graduations are happening. Congratulations to our graduates. There's some graduations going on this week we'll be a part of. Congratulations to them and the families and the faculty. I mean, there's just so much celebration, and it comes at a very critical time in this pandemic. You know, we've gone through some tough times. We lost some loved ones. Our thoughts and prayers go out to them, and people are still healing. But now we're starting to gather around, gather together again, which is great. And about it's all a part of healing our nation to be amongst one another. Graduations are a celebration, promotions are a celebration, and guess what? Sunday is Mother's Day. We're going to be celebrating our mothers and our true leaders in our communities that have been standing strong, resilient, and telling us young people and the kids to wear our masks, get vaccinated. That's where teaching begins, ladies and gentlemen. First, on our parents. Very important. So, young people and those that haven't gotten vaccinated, if mom and dad said, go get your vaccination, follow their teaching. And as I said, over 65%, I'm sorry, 65 and over uh, of our elders are fully vaccinated. 89%, it's probably 90% now. So they're taking this pandemic very seriously. And let's honor our ancestors. Let's honor those who have fallen because of COVID by getting our vaccination. A lot of vaccination events happening today. They're using the motto, "May the fourth be with you." Put your armor on, and as we go into battle, and let's get our vaccinations all across the Navajo Nation. Uh, we have healthcare facilities doing that, so we encourage you to do just that. Happy Mother's Day to our mothers, strong mothers that are fighting for us each and every day, praying for us. Young people, people out there, there's always someone praying for us. And it's usually our mothers, our guardians, our parents, our grandparents, our aunties that are always praying for us and helping each other out and always praying for the Navajo people. And we also honor our frontline workers, which is National Nurses Day on Friday, May 6th. So let's pray for our nurses, our frontline warriors, of course. I know every time I say something, we honor one group. There's a lot more others that want to be recognized. And we honor everyone on the front lines of this pandemic. We honor all of you. But there are certain national awareness days and weeks we would try to highlight. But if you have others, send it our way, text it, comment us. I know it's Teacher Appreciation Week, and we appreciate our teachers as well. And tomorrow is the missing persons awareness. And I say missing persons because we want to find our loved ones. We want to find that closure for many of our families. There are over 50 people that have been reported missing on the Navajo Nation since the 70s. And we ask you to tune in tomorrow for our MMIP, Missing and Murdered Indigenous Peoples events. And it'll be on our Facebook page. Come and join us. So the pandemic. Yesterday, we thank God that there was only 3 cases. Those 3 individuals who our thoughts and prayers go out to you. And I'm sure you're vaccinated. You'll bounce right back because these vaccinations do work. Ask somebody. Ask somebody who got the vaccine and then later on got the COVID-19. How they went through the sickness. Some will tell you it only lasted a few days. They recovered quickly, and it's really because of the vaccine. Those that aren't vaccinated, that's the one that we have to, encourage to get vaccinated. Those are the ones that end up in the hospital for a very long time. We know that. Yesterday, no deaths as well. Eli, if you could put the screen up, we are moving through, but again, we're coming to you live every week because we're not out of the pandemic yet. We're still in a pandemic. That's why we keep coming up every Tuesday to let you know what's going on. And we want everybody just to be careful. Wear your mask. Yeah, I always get comments, people saying, um, president's not wearing his mask. But, when I am people, I take off my mask for a photo. I ask the group that I'm standing with if everybody's vaccinated. You know, yeah, of course it's an honor system, but I believe them. I trust them. And when they say, yeah, we're all vaccinated, I take off my mask. We all take off our mask, and then we get our photo. And I take off my mask when I'm speaking in public as well, and to let everybody know that I'm there. And to let our people know that we are overcoming this virus. Yes, we have a mask mandate in place. We continue to do that. And as we celebrate graduations, Mother's Day, and these events that are taking place throughout the Navajo Nation, let's continue to wear our mask. Let's continue to follow these protocols because it works, ladies and gentlemen. It works. Look at Navajo. 3 cases yesterday, 0 deaths. We're doing something right. And those of you that say masks don't work or don't wear diapers on your face, you're wrong. I don't know if you could just look at the data, that this is a pure example of how to push back on COVID-19. Navajo Nation is that example all across the country. Everybody looks at us. And as I said in my prayer, when someone asks you, how did the Navajo Nation turn it around? It's because of our Navajo people, and it's because of our Creator, our prayers that have helped us through these difficult times. And if you look at the slide 2 there, you can see the progression of the virus and the deaths. April 22nd, we have 15 deaths. I know that makes it look like in one day 15 people died. No. Again, I want to explain that sometimes there's delayed reporting. Some of our Navajo people that got taken off the Navajo Nation to be cared for, off the Navajo Nation, they may have been in the hospital for weeks or maybe even months, and maybe they don't make it. But it seems like right now they caught the virus, and then one week later they passed. No, some of them caught the virus maybe last year, maybe early on in the year, and they hung on, but they didn't make it. And so when the state reports that, it slowly comes back because all across the country it's starting to drop. So all these healthcare facilities are going back to normal operation, doing surgeries, doing regular appointments. And so sometimes they don't report every day like they used to. Maybe every other day, maybe once a week, twice a week, things like that. And so there's a lot of delayed reporting. When they put all the reporting, and we have to do audits too. We got to go reach out and find out where our Navajo people are, and that's why there's a reconciliation of numbers. And then sometimes that's why you get a big spike like that. But overall, since April 23rd to May 3rd, we have not seen anybody uh, pass. That's what I have on the screen there, the second slide. But if you see the COVID-19 daily case count rate, you see it fluctuates. 20, 31 at times, and back to a low number. So let's continue to stay vigilant, stay the course. Slide 3 again just shows you the progression. Yes, we bring this up all the time, but I just want everyone that's watching to look at this chart here. It shows you that if we continue to keep those protocols in place, we're able to keep it very low. It's when we start, um, letting our guard down. And even if we let our guard down just a little bit, it takes off in our homes, skyrockets. And you see that happen about 4 times here on the Navajo Nation. So stay the course, ladies and gentlemen. And the fourth slide, the final slide, over 75% of our Navajo people have 1 and 2nd doses. Booster shots are being done, third shots, fourth shots. Fourth shots are now available for elderly and those that are in that like our first responders that are always uh, out there with the people. And I haven't get my fourth shot because it's every 6 months, and I'm not in that 6 months yet. I think it's June or July is where I'll be 6 months to get my fourth shot. So I will get my fourth shot when I'm available when it's available to me based on that criteria. But as you see on the screen, these percentages are slowly moving up. Look at the elders, 89.5%, as I mentioned, vaccinated. And our kids, 5 to 11, yes, it's low because they just recently got the approval to get their vaccination. But I just applaud the young people, 12 to 19, 74.6%. And you know what? When I talk to the young people out there, when I'm at the schools and stuff, I just ask them, how come you got your shot? Well, first, one of them will say, because my mom and dad made us, you know. That's awesome, parents. You know, you didn't give your child a choice because they're still under your roof, right? Because you're still protecting them. Just like measles, mumps, and rubella, we had to get those for our students to go into school. But a lot of them, you know what they said? They wanted to go back to school to see their friends. And in order to do that, they wanted to get their vaccine so that they could be safe. And they thought about their families, their colleagues, their peers, and it's pretty awesome to see these young people. They're leading us now. You know, we talk about future leaders, but they're leading us now, and I applaud them. And what I just want to say to everybody again is congratulations to all our graduates out there. Le hutat da oftragi don college university da oftragi ado kuje nas eight ata da iftragi ya eighth grade 18 dan lenigi eighth 12th grade na kitsata da iftragi do edo he na kalchen anin da kaigi da isin the head start face program do tse bija da oftragi da iftragi le high school biche ajishi start day lehgi do ya ba hehnitz alla hande le shi do le ju kade ya analia akonda hadaino nindishni ya le alla handa le ho ye master das in do juda ita in na che kundeli akonda daso ki ashwade ahandi kunashni hote aron khal chindo he tabdine yego ekodo nakhayadash hit dash ken de ya ngalchen de mas so dash dan hilne ya is dan lind ya بالبدا هزنوت اديها ishini hil ya ishnegi akon de ka nature hot aro amado noslnegi ya amma je shade shiteje da noslnegi koje sana noslnegi amma noslnegi hela i de mo gonne e ya amma amma behani nihye nache ina nasiti do don hi edo nasiti johot san of the nihitzi do ben nache ekodo hada anil ne anil so not anin de akot masan he adnala san no senigi he la na kina khaydiha ishi nihilyaha ni hikujo ndahot nakhalchin biche yadal ti ash khona shi yaje we nakhada atse yemas chadas ada hoshya ja ena antkine ena siti shmado koshishnisha shmasan ye do koshishnisha ne yego ant shi yaje we binaga hainl naso ntsilo inal tolle nakhatso dilzen dan hitet non i yada ho ke lama mayaj andala sanan nosleni eshi Sunday gonna the mo gonna behani konde kuije ma behani ya ama nosleni he dan hidi ni dole so kon so shi hanne koni kodel ya dole shi ke nosleni do ada hasya do ni master dasle. So the next person on the presentation Dr. Vaugh. Dr. Vaugh has been a great advocate, great friend to the Navajo Nation, was here throughout the pandemic, helping us getting all the data, the information. So has been Dale Yazzie, one of our own, became an epidemiologist, came home. There's a lot of our Navajo people at Department of Health, IHS doing an outstanding job. And you know what? We're not giving up on the Navajo people. That's why we keep telling you all to take care of yourself. And we're going to continue to get these Tuesday town halls to you so you can share it with your family members. I know a lot of English has been mentioned. I do my best to switch hit, but some we don't translate, but that's where you come in as family members. Help us out, translate it into Navajo. So I'm going to turn the time over to the Indian Health Services, Dr. Vaughn. Take it away.
Hi, thank you for that. My apologies for that audio mishap. Thank you so much for giving me the opportunity to join this town hall. Thank you, President Nez. Thank you for your leadership. I am joining on behalf of our IHS team, Captain Johnson, Director So, and of course, I always have the joy of working with our Navajo Nation counterparts, such as my co-lead, Del Yazzie. So it's always a joy to be able to join on these calls and provide an update to the communities that we serve. On behalf of IHS, we value our collaborative partnership very much and continue to do so. And so some updates that I do want to provide that that Del will likely dive in a bit more is that President Nez is absolutely correct. The pandemic is not over. We are indeed in a better place. We are in this phase where now we have tools to really control this. And when I say that, I'm speaking of course, our vaccines, our boosters, treatment, and then all those layers that we continue to pile on to protect our folks and ourselves as much as possible. And so IHS will continue to work with our Navajo Nation partners to make sure that there is access. First of all, resources are available throughout. And when I say that, I'm talking about masks, tests, and treatment, and of course, vaccines and boosters. So we want to make sure that our partnership enhances that the resources are going to be available, and not just available, but also accessible to folks out there in the community, and even in our most difficult to reach geographical areas or even difficult to reach populations. That is a priority for us. Together, we are working on making sure those systems are in place and that they are working. And so, yes, please, vaccines and boosters. Boosters work. They are effective. Data after data, report after report across the globe, across the nation, show us that boosters are really effective at preventing hospitalizations and deaths. And so please get your booster if you're eligible for your booster. And of course, get your vaccine if you're not yet, haven't started that series yet. We know they continue to be effective even with the most current strains, such as Omicron or Stealth Omicron or all these variants that are floating about. The other thing I also want to make sure that the folks here on this town hall know is that regardless of your vaccine status, please test. We have tests available not only at our facilities across our service unit in regards to lab tests, but we also have home test kits, and we are working to make sure that our service units have access to those resources so that they can give them out as needed. You can test whenever you feel the need to test, whether you're symptomatic, whether you want to go to an outing and you just want to make sure, or just in the comfort of your own home and you're just curious, am I positive? Please get a home test kit, please test. The other benefit of testing is if you are symptomatic and you test early, you may be eligible for treatment. And we have worked with all of our service unit facilities to make sure that treatment is available. We do know that our first-line treatment, including oral pills, are effective against the current variants of Omicron. or of COVID. So if you are symptomatic, please don't hesitate. Please test because now treatment is available and you will be able to be connected to treatment and evaluated to see whether or not you're eligible. So don't hesitate. The other priority that we are working on together as a collaboration is long COVID. We do want to make sure that we have a better understanding on how long COVID is impacting our community members, and so we need to screen for it. Not only do after we screen and understand that, we have to connect folks to care. And so as a collaborative effort, we are working with our service units as well as our clinical leads to improve screening and then coordination of care for those that need it most. Other things that are not COVID related that I do want to provide an update is flu. We are seeing flu cases, so please get your flu vaccine. And this, if you are symptomatic, it may not be COVID, it can also be flu. And then one other point that we want to make sure folks on the call are knowledgeable of is, of course, hantavirus. I know that spring is here, and so spring cleaning is a common thing that folks do. So please take the appropriate precautions when doing spring cleaning, for example, the use of a mask or a respirator. And that is my update for now. And I believe my co-lead, Del Yazzie, is up next. Is that correct?
Yes, Dr. Va. Thank you. All right. Hello, everyone. Thank you all for joining us. Thank you, President Nez and Dr. Va and our whole team for joining and being a part of this meeting as well. So, hi, everyone. My name is Del, and I'm also part of the our Health Command Operations Center COVID epidemiology team. As Dr. Va mentioned, she and I co-lead the team, the epidemiology team. And I'm also part of the NAVO Epidemiology Center within the NAVO Department of Health. And I'll provide the weekly updates as far as COVID disease tracking, national ka on the nation, a 2-week time period here, April 15th through the 28th. And but before I move on, I try to always acknowledge our epidemiology team. We are a large group. If this is your first time to the town hall, we are a big epidemiology team covering surveilling COVID for Navajo Nation. Just want to cover this right part of the screen here or the slide. We have people on our team from the Navajo Epicenter, which is part of our Navajo Department of Health. And then we have members from the Indian Health Service, from the Navajo Area IHS, and then from the tribal health organizations, they're also known as 638 facilities on Navajo Nation. And we have some folks working with us from CDC and the CDC Foundation, all the way from Atlanta, Georgia. A lot of them are helping us virtually. And then we also have members from the Johns Hopkins Center for American Indian Health, and also COPE and TGen, Translational Genomics, out of Flagstaff campus. They're the ones who are helping us conduct the sequencing work for COVID strain surveillance. And then, of course, our state partners from Arizona, New Mexico, and Utah. So just wanted to recognize our EPI team. So this is our latest recent cases and trends. As you see, this is a 60-day time window from early March all the way to end of April, essentially. April 28th is the last date here. As you can see, these bars, they go up and down, as President Nez was mentioning. Our number of cases do fluctuate every day for various reasons. Some are delayed reporting, but we have this red line that really just combines these data points to make it a smoother line so that it's easier to see for trends. As you can see towards on the right side here, we are seeing a bit of an increase in cases within the past couple of weeks. And our infection day, 7-day infection rate is now above 1. And our threshold is right at 1. So we have gone above 1, which is something we'll continue to monitor closely. And then this is case incidents across Navajo Nation, here spatially or geographically by IHS service areas and also our bordering states. And so Tuba City is the service area with the highest highest case rate, a 7-day case rate, being over 100 plus cases per 100,000 people. And then next is here's 50 to 99 cases per 100,000 is Kayenta, Chinle, and Gallup service areas. And then with the least or the lowest 7-day case rate from 0 to 49 cases per 100,000 are Winslow, Fort Defiance, Shiprock, and Crown Point. So there were 117 new cases over a 7-day period from April 22nd through the 28th, which puts our 7-day case rate at 74 cases per 100,000 people, which is actually in the orange level of our threshold, and which is substantial transmission per CDC threshold levels. So that's why this box is orange. And then next is some additional metrics here. This is testing. This is all lab-based testing from the hospitals that we collected the data from. So our 7-day test positivity rate is at 6%. And we've been hovering around here for the past month or so. So it's stable. I hope it doesn't go up. And then there are 455 average daily tests were conducted over a 7-day period. So there's still testing going on across the nation. And then another metric we look at is hospital capacity. This is hospital beds that are occupied by COVID patients. And regular beds is at 60%. Then ICU beds is at 80%. And these percentages have been somewhat stable over the past month as well. So we closely monitor these metrics on a daily basis. This is the latest vaccine numbers for Navajo Nation residents, folks who live on the nation only. So this is 125,397 residents have completed the primary series. And then 84,599 residents are up to date, meaning they have the booster shot as well. So that puts us at 45% are up to date, and then 67%, close to 70%, have completed the primary series. This is our epidemic or curves for COVID throughout the pandemic. As you can see over on the right, these two lines are, the blue one is the US, and the orange line is Navajo Nation. And we are currently seeing a little bit of an increase in cases across the country, as well as on the Navajo Nation. I just like to mention here there are two vertices here. This left side is for the orange, I'm sorry, for the blue curve, which is the US. And then the one over here on the right is for Navajo Nation. So I want to highlight back in, mid-March, around there, we were at the lowest peak for the US, which was around about 25,000 cases um, over a 15-day period. But now, as you see this ink blue line across the US is now at 60. So there is 60,000. Um, so there's an increase. And the same with Navajo Nation. We were at like 6 around late March. And now we've gone up to 18. So there is an increase across Navajo as well. So just wanted to highlight that there are two vertices on this graph. This is the 7-day incidence bar chart comparing Navajo Nation to the 50 states and a couple of jurisdictions. Here, the yellow bar is Navajo Nation, which is at 28th position. And we've been around upper 20s, low 30s for about a month or so. So we're remaining stable. And the red bars are our bordering states, Colorado, New Mexico, Utah, and Arizona. So you see up here all these um, larger bars are all on the East Coast, Northeast part of the country for the most part. As you can see here, up in the Northeast section are the darker blue shaded colors here for higher 7-day case rates, plus the kind of the West Coast, Washington, Oregon, and California as well. But within our region, excuse me, just Colorado and New Mexico with this darker shaded blue color with higher 7-day case rate compared to Utah and Arizona. This is community transmission by counties. So just focusing on the counties within Navajo Nation. This is Apache County in red, which means high COVID transmission. And then Navajo and Coconino counties in Arizona in the orange with substantial COVID transmission. And then on the New Mexico side, there's San Juan County and McKinley counties. They're in the yellow and orange for moderate and substantial COVID transmission. Then over on the Utah side, this is San Juan County of Utah in blue, meaning low COVID transmission. This is the Navajo Nation's COVID strain surveillance. The latest numbers here for report 53. This came out May 3rd, which is yesterday. So Omicron variant went from 1727 to 1736. So there are like 9 new cases with this Omicron variant. But this next row is the BA2 Omicron sublineage, which went from 11 to 23. So there were 12 new cases identified with the BA2 sublineage of Omicron. So this is becoming, we're seeing more of the BA2 currently as in the sequencing surveillance of cases on Navajo. And then all the other variants listed here stayed the same. And then comparing it to the CDC variant profile, this is for the entire US. As I mentioned here, the BA2 is now the predominant variant across the country at almost 62%. And then the other highlight here is this orange colorish bar here, which is the BA2.12.1, which is also trending upwards across the country. So these two, the BA2 and the BA2.12.1, are the two really currently the predominant variants being detected across the US. And then this is the 10 chapters that made the high risk chapter list. And these are chapters that have seen increase in COVID cases with their 7-day case rates above 100 cases per 100,000 population over a 2-week time period. That's how these chapters are identified as high risk COVID high risk chapters. And then last here is our risk level assessment. We remain in the orange level with 23% increase in cases from last week. So we are seeing a little bit of an uptick in cases. And then also there are these sublineages identified on the nation, which is, I just mentioned, these are the 2 sublineages of Omicron that are currently the predominant variants across the country, and they have been identified and detected on the nation. And then the lab-based test positivity remains low and stable, as I mentioned, at 6%. And then as well as our hospital capacities for regular hospital beds and ICU beds are also remaining stable. And last, where are we right now? Because of our cases, a little bit of an uptick in cases puts us in the orange level of our response. And for that reason, we're saying we're in the orange. The other 2 are in the yellow, the lab-based testing and the hospital bed capacity. So if 2 colors, if 2 indicators suggest different threshold levels, the higher level is selected. For that reason, we're saying orange. So I'm going to stop here, and let me check if anyone else has joined us. I don't see Dr. Fowler on the call, so unless Dr. Va has any other additional comments, I believe we're going to end here, correct, Eli? So thank you all for joining us, and we will see you all again next week. Thank you.